coming from a patient advocate's perspective, I was noting down a few questions. Um, what I would want to know is proton therapy covered under insurance in India? Dr. Srinivas?
See, most of the insurances do cover these, but the whole issue is that most of the people have insurance up to 5 lakhs or up to 10 lakh rupees, which is not sufficient to cover the entire course of treatment with proton. But some insurances, wherever they have insurances up to a much higher range, proton therapy has been approved by several private insurances. But as of today, unfortunately, most of the patients do pay from pocket in India. We do see patients coming from abroad as well, a lot of them. In fact, 40% of our patients have been from abroad. And all of them have had some insurances, either paid by the governments or by private insurers.
Thank you so much. Now that we are more than 2 years down the line with proton therapy in India, are we having any plan of government being involved to make it with the government scheme a bit more reachable to the general public? Because right now it is totally at the upscale.
Yeah, absolutely. Ms. Priyanka, this is a very good question. Hopefully with more proton therapy centers coming in, the footprint of proton therapy coming down, the cost of proton therapy is likely to come down significantly, hopefully in the future. But as of today, it is indeed nearly 8 to 10 times expensive than conventional radiation therapy techniques in India, which is unfortunate. The hospital, our hospital is trying to engage with governmental and insurance and everyone, all the stakeholders, to make sure that it is possible for right patient to receive this treatment. For example, Himachal Pradesh government has approved close to 4 or 5 patients whom we have treated. Of all of them were chordoma patients. In fact, all of them were paid by the government. So there is some, to degree, very little success we have started to see. But hopefully we will have to engage more, and hopefully the center in Tata Memorial, when it comes, that would open up larger avenues for more acceptability by the patient groups as well as the government and insurance and everyone.
What is the time frame of the treatment? Of course, it will depend on the case and the type of sarcoma, but generally, what is the bracket that we're talking about a proton therapy treatment, both in India and US?
So whether it is India or US, normally most of the fractionation is given over a period of 6 weeks. It ranges from 5 to 7 weeks. I'm sure that is the same in United States as well. Dr. Matt or Dr. Mudit, anyone can take it.
Mudit, is the time frame similar in US or?
So sorry, I wasn't able to hear for a few minutes. Could you say that one more time?
No, I said, yeah.
Yes, Dr. Srinivas.
Yeah, in India, we most of the fractionation we use for sarcomas is between 5 to 7 weeks, which is typical. Typical fractionation used in India. And what about in US? I'm sure it's the same.
Yeah, it is the same. So for a preoperative setting, we usually try to give 50 gray and 25 fractions. That's the standard approach. And for postoperative, it ranges from a minimum dose of 60 gray and 30 fractions, and then going upwards based on some of the details of the surgery. For example, like how much, if any, is left behind. So that's kind of what we've historically done our dosing off of. More recently, there are some smaller studies, some single institutional studies that are looking to shorten that dosing scheme. So kind of in a 5 fraction regimen, actually. So we're seeing anywhere from 30 gray and 5 fractions and higher in the preoperative setting, but that's we have to be careful in applying that for all of our patients, as that is still considered experimental um, and very, very new. So again, the standard dosing is, I completely agree with you, over 5 to 6 weeks.
Thank you. And I have one last question, which will be open to the panelists. What are the points one should consider before finalizing proton therapy as a line of treatment?
I can speak a little bit about our process at our center for this. So when we do have a patient that comes in that's a candidate for proton therapy, we actually have a team that reviews the cases, sort of to triage the case to make sure that it's appropriate. And then in the United States, insurance coverage is often a point of discussion, because I think in a lot of instances, there's a little bit of a resistance to offering proton therapy because of the cost, or covering proton therapy because of the cost. So we think a little bit about that as well. And then the last thing that we think about is benefit and any challenges with the case. So what I mean by that is, we talked about how patients with lateralized tumors or tumors on the side of the body versus the middle, those are ideal cases for proton therapy. But there are some cases that are challenging as well. For example, if patients have medical devices that are implanted near where we might be radiating, that might be something where we, what I mean by that is like a pacemaker or metal things, like sometimes with spinal surgeries, we'll see metal pieces put in to help stabilize the area after the surgery. Those can sometimes make it challenging to model proton therapy dose in our computers. And those might be cases where we would actually end up not using it because it might not be as good in that case. So that's the process that we use to think about how we ideally select patients for proton therapy, among other factors that have kind of been discussed. And then once that's done and we agree that it's a good case, we would proceed forward with treatment planning and go from there.
I think in addition, to add to what Dr. Sprecher said, which I completely agree with, is, as a patient, especially in the United States, but also certainly in India, where the number of proton centers are limited, is from a patient standpoint, being an advocate for yourself and really talking in truth, and sort of just talking also just very specifically with your radiation oncologist about cost, about affordability, about the ability to travel the distance or stay away from home for the duration that you may need to, and using all of those elements and really having a very frank conversation with your radiation oncologist about the degree of benefit that protons in your specific case would allow, and sort of balancing all of the clinical and non-clinical factors that should go into it.
Thank you,
Priyanka,
Doctor.
if I may add, normally what we are doing is we receive a lot of inquiries either from patients or doctors themselves, either radiation oncologists or orthopedic surgeons. Either they send us an email or call us or send something on WhatsApp, images. We get all the images. We try to quantify the benefit, because we don't want to invite everyone to Proton Center. This is the only center available. We want to make a preliminary kind of a discussion, as Dr. Matt mentioned, kind of a triaging, whether this patient would be likely to benefit with proton, and then would convey the same to the patient or to the doctor. And then once the patient makes a decision that yes, proton is indeed an option for the patient, then they come to Chennai. Then we have a detailed discussion, detailed evaluation of the imaging, on MDT discussion, and whether proton would be really beneficial and how much would be of benefit, what is the cost benefit ratio. And based on that, the patient takes a decision whether or not he or she would like to go for proton therapy. Then we go ahead and treat. And as Dr. Matt mentioned, most of the steps beautifully well. So we do the same here at our center in Chennai.
That was a very valid explanation, Dr. Srinivas. Thank you so much. We sitting in North India, and the Proton Center in India available at Chennai, which is to the south of India, people who are faced with proton therapy as a line of treatment usually come up with a question: can it not be cured by radiation? Do I really need proton? To convince them at that point, the logic that you've put forward goes a long way. Thank you so much.